Your poop is usually brown because of bile, a digestive fluid made by your liver that helps break down fats. As bile moves through your digestive system, it changes chemically. By the time waste leaves your body, that process usually creates the brown color most people expect. But poop color can change for many everyday reasons, and often it's harmless. One of the most common causes is food. Eating lots of leafy greens can sometimes make poop look green, because chlorophyll and faster digestion can leave less time for bile to fully break down. Beets, red food coloring, or brightly colored foods can sometimes cause red or pink stool. Iron supplements, eating black licorice, or medicines containing bismuth, like Pepto-Bismol, can sometimes make stool look darker or even black. Digestion speed also matters. If food moves through your digestive system faster than normal, bile may not fully break down, which can lead to greenish stool. Yellow or greasy stool can sometimes be linked to fat digestion or absorption changes. Pale white or clay-colored stool can sometimes suggest reduced bile reaching the intestines. Black, tarry stool or bright red blood should be taken more seriously, especially if it happens more than once or appears with pain, weakness, dizziness, or other symptoms. Practical check. If your poop changes color, first consider foods you recently ate, new vitamins or supplements, medications, hydration, digestive symptoms. Many color changes are temporary and related to diet. Common color guide. Brown, usually normal digestion and bile breakdown. Green, leafy greens, food dye, or faster digestion. Red or pink, beets, food dye, or sometimes blood. Black, iron supplements, bismuth, or possibly digested blood. Yellow or greasy, possible fat absorption or digestive changes. Pale or clay-colored, possible reduced bile flow. What to do? If the color change happens once after certain foods, supplements, or medications, monitor it. If unusual color continues, happens repeatedly, or appears with pain, dizziness, weakness, bleeding, or other concerning symptoms, medical evaluation may be appropriate. Simple takeaway: poop color often reflects digestion, bile, diet, medication, and hydration, not just illness. Brown is common. Temporary color changes are often harmless, and understanding what affects color can help you better interpret what your body may be responding to. Your poop can change color for many normal reasons, and sometimes it's simply useful information about what's happening inside your digestive system. But poop color is only one part of the bathroom story. The way stool leaves your body also depends on body position. Most modern toilets put people in a seated position with the knees about level with the hips. That position works for many people, but it is not always the easiest position for the body. Inside the pelvis, there is a muscle called the puborectalis. You can think of it like a sling that helps hold part of the rectum at an angle. That angle helps keep stool in place when you are not using the bathroom. When it is time to poop, the body relaxes that muscle so stool can pass. But posture can affect how open that pathway becomes. When you sit straight up with your knees low, the angle may stay more bent. When your knees are raised above your hips, the angle can straighten more. That is why a squatting position, or a seated position with a small footstool under your feet, can make pooping easier for some people. It does not force your body to go. It simply puts your body in a position where there may be less resistance. The practical method is simple. Place your feet on a small stool so your knees are slightly higher than your hips. Lean forward slightly. Rest your elbows near your knees. Relax your stomach, hips, and pelvic floor. Breathe normally. Avoid holding your breath or pushing hard. The goal is not to strain harder. The goal is to make the path easier. If you often sit for a long time, push forcefully, or feel blocked, changing position may help. But posture is only one factor. Constipation can also involve hydration, fiber intake, stress, medication, digestion speed, and other health conditions. So the takeaway is this: pooping position can affect how easily stool leaves the body. A small change, like raising your knees with a footstool and leaning forward, may reduce resistance and make the process easier. Your bathroom habits are connected to body mechanics, not just digestion.